You, my friend, whether you believe it or not, are playing a role of a leader. You are creating and shaping the culture of healthcare just by being a pediatric pain physician. Now think about that. You're listening to Pedia Pain Focus, episode number 40. Today, we will discuss the making of a pediatric pain physician in today's healthcare. In this episode, we'll talk about the traditional role that a physician plays, and especially the role that a pediatric pain physician plays with the changing trajectory of the healthcare in the 21st century. So stay tuned.
Pedia Pain Focus.
You're listening to Pedia Pain Focus, brought to you by Proactive Pain Solutions. Pedia Pain Focus highlights pediatric pain information and provides tools and resources for all healthcare professionals taking care of children dealing with pain. Here's your host, Dr. Anjana Kundu.
Hello there, ladies and gentlemen. This is Dr. Anjana Kundu, your host for Pedia Pain Focus. Thank you for joining me once again and for this lively discussion around what the role of a pediatric pain physician in today's healthcare is or should be. Now, as physicians, we are considered as influential citizens because of our level of education and our status in the society. And no, I'm not saying this. This is a well-propagated belief. But given the scientific and technological advances over the past couple of decades, it has resulted in changed perceptions and expectations from the healthcare system and especially the providers of healthcare, mainly the physicians. We've also seen changes in the scope of practice of various providers in this healthcare system. So it's all the more relevant that we examine what roles do physicians play? What are the roles of other healthcare professionals, even though we won't go into the details of the roles of others, because we want to keep this focused to the role of physicians today and how it relates to other healthcare professionals. But just with all these changes, we know that it has led to significant shifts in the practice of medicine and the medical profession overall. Whether it's good or bad is not up for debate, not in today's episode, but something that we need to at least consider in the privacy of our own thoughts or even within our discussions and as we evaluate the roles that we play or we intend to play, and how do we show up at our very best and serve the purpose that we have chosen to in this profession. We also know that there's one thing that's very clear. As the healthcare landscape continues to evolve, we need to reimagine and re-engineer the role that a physician plays in today's world, especially as it relates to a pediatric pain physician. And that requires the physicians to fully understand and embrace their roles in the healthcare in general, regardless of whether it was a traditionally believed role, especially as it is expected with all these brand new changes that are occurring with evolution of our society, right? Now, we all know that medicine is a helping profession, and the primary purpose of this profession is to serve the needs of our patients, but it's really not just limited to the clinical care that we provide within our clinics or hospitals or healthcare facilities. It extends way beyond that. Especially as a physician, the role that we play is much bigger and much more multifaceted. As a matter of fact, Flexner in 1910 said that a physician's function is social and preventive rather than individual and curative. Now, that's a big statement, especially coming in the beginnings of 20th century. And here we are in the 21st century. That has remained the same in some ways, but the context of how we serve those roles as being social and preventive rather than individual and curative has changed for sure. And that's what we're going to dissect and look at today. So as physicians, we have health promoting functions, and we need to emphasize caring as well as curing for our patients and families, or those whose health we're responsible for. So as doctors, as physicians, we must advise, if possible, cure, and definitely support during our patients and their caregivers' hardships. So, contrary to the common perception that a physician's role is primarily as a clinical medical expert, we actually play a multidimensional role. Our role, especially as pediatric pain physician, actually extends way beyond just being the diagnoser or treater of pain. In fact, our role extends way beyond our interaction with our patients and families. It extends to other departments, our other specialties within the hospital, in our community, and in the society as a whole. Even if you don't look at yourself in that sense, or with that lens, or with that perception of your role as a leader at such a big stage, you actually are serving that role. You, my friend, whether you believe it or not, are playing a role of a leader. You are creating and shaping the culture of healthcare just by being a pediatric pain physician. Now think about that. Now that's a heavy cross to carry. However, I don't want you to be afraid. I want you to come along in this journey with me and look at what are the traditional roles a physician has been asked to play or has been expected to play. In addition to our medical expertise with our patients, as physicians, we are also traditionally viewed as playing an integral part and as influencing the entire healthcare system within our practices, institutions, facilities, and the society at large, as I just said. And whether you see yourself as that or not, but here's how your role as a physician is viewed. You're viewed as a medical expert, a communicator, collaborator, a leader, manager, or administrator, as a health advocate, a scholar and an educator, and a professional. So let's dissect them one by one. As a medical expert, you are the one who understands, assesses, reduces, treats, or when possible, eliminates pain and its related impact. And as we know, the impact of pain goes beyond just the nociceptive or impact on the body, the physical sensation of pain. It goes to extend on patients' mood, their function, their sleep, their social relationships, and even their economic expenses as well as ability to make a living. So we have to be able to evaluate and impact positively all those aspects of their lives. So in other words, we are applying our knowledge and mastery of our skills to help make life-altering decisions and creating solutions based on our health scientific knowledge and improving the quality of the life of our patients, whether we are faced with situations that we understand entirely, or even when there are situations where we don't have adequate information, especially in case of pain, where there's still a lot that needs to be discovered and understood. There's still uncertainty about the evidence and the best practices, but we still need to ensure the best interest of our patients. We have to help restore or improve their quality of life, and we are trained to provide the most comprehensive and personalized care plans for our patients, especially when it comes to pediatric pain. Now, I can understand and hear some of you saying, but what about the standardized treatment protocols, which have gained so much popularity? Of course, those make sense. And of course, that itself requires our mastery of skills and the expertise in knowing those. But our skills, especially in pediatric pain management, go beyond just the standardized protocols. We absolutely need to recognize how pain, especially, is a very individual and a personal experience. By very definition of pain, we know it's a unpleasant sensory and emotional experience. And we all know that emotions are very personal, and even the sensations and how we process pain is very personal. So it's an individual experience. It's very personalized. Therefore, our treatment plans also need to take into consideration our expertise, our ability to relay that information to our patients and to be able to interact with them. All depends on individualized plans. So we need to not only understand where the standardized protocols apply, but we also need to have a great understanding of how to individualize what elements of diagnosis and treatment need to be individualized. And all this needs to be done in the context of ensuring that this still incorporates a multidisciplinary and comprehensive treatment plan. As a pediatric pain professional, we need to understand the nuances of pediatric pain medicine and our own role in healthcare, the healthcare delivery or the healthcare economics. As you know, we've done several episodes that have discussed how and what the nuances of pediatric pain are, how it is unique, what the different challenges are. So if you haven't, please go back and listen to some of our episodes, and I will also include the links in our show notes related to those. As pediatric pain professionals, we also impact the delivery of the quality of care throughout the institution. So remember, the quality of the healthcare and the outcomes is determined significantly by their experience with pain and pain management. So the lack of pain management or adequacy of pain management will determine not only their satisfaction, but their perception of the quality of care, as well as the actual speed of their recovery. So that itself impacts the quality of care these patients receive. And as a pediatric pain professional, you also need to understand and evaluate and manage the influences and the context of pain and its impact on healthcare. So not just the nociceptive aspects of pain. As we know, acute pain influences your physiology entirely, and therefore your speed of recovery and other aspects of your healthcare. But beyond that, all the other influencers of a pain experience also come into play, and we need to understand, evaluate, and manage those influences of the pain experiences beyond just the nociceptive and the physical sensory aspects of pain. So we have to also understand the context of emotions, the cultural context that your patient is part of, their community, their social structure, the school environment, the physical activities, the relationships within the family, and the relationships of the other family members within that family structure and family tree. They all influence the quality and the quantity of pain our patient is going to experience. Which then takes us on a little side trip to look at the unique aspects of pediatric pain. Again, something we've discussed on multiple occasions in different episodes as well, but just quick review of some of the unique aspects of pediatric. As a pediatric pain physician, you're well aware that we are simultaneously treating multiple patients and multiple treatment targets. What do I mean by that? Multiple patients because you never have just one patient. You've got the child as your patient, but the parents or the caregivers are also your patients. And sometimes it goes even beyond that. Sometimes you even have to take into consideration their siblings and the other social relationships into this picture, which then tells us that all these different treatment targets that we have to address. So we have to not only address the treatment targets that directly apply to our patient, but also to their parents, to the school system, how that impacts their ability to attend school or not attend school, or having to make adjustments in school, or to their physical activity and PE, or their relationships with their siblings and their ability to function as a family member, being able to do their chores or any modifications that may be needed. So all those things we need to take into consideration. The other unique aspect of pediatric patients is the fact that their neurodevelopmental ranges are widely varying. So we've got premature and neonates as our patients, as well as young adults and almost adults as our patients. And we all know that their physiology, their pharmacokinetics, their pharmacodynamics, as well as their cognitive and emotional developmental stages are very different. Their social contexts are different. Their behaviors are different. Their relationships are different. So we have to be well versed and knowledgeable of all the different aspects and variable ranges and their influences on their pain, as well as their treatment plan and treatment outcomes. We have to be aware of the age and neurodevelopmental and cognitively appropriate assessment tools and treatment options. So with all that in background, we know that as pediatric pain physicians, we are having to balance a very complex matrix that influences how our medical expertise plays a role in the care of our patients. So being a medical expert in today's world is even more complex because you're also having to take into consideration not only your traditional role where you're expected to provide this expertise, but also take into consideration the fact that even the parents nowadays have the expertise available to them freely online, through Google, through Facebook, through other community support groups and parental support groups. So we need to take into consideration all the other pieces of information that these parents are being exposed to. And with the evolution of society and culture, we know that the locus of medical knowledge that was traditionally held by a physician has now shifted. It has moved out of the minds of these physicians into more of this public and digital domains, right? The medical marketplace is increasingly being driven by technology. And what we're talking about is the wearables, all the different apps, and the big data. So all these digital health trends are really changing how our medical expertise has to shift. Our role as a medical expert has to take into consideration all these factors that also coexist. So we have to be able to balance our ability to provide our expert opinion based on our years and years of training with the freely available medical expertise. Again, we all understand that not all of that freely available information, as a matter of fact, a lot of that is not very useful and can be very confusing for our patients. Yet, we need to acknowledge and take that into consideration when we are playing that expert role. So we have to be able to balance our expertise with the freely available expertise that our patients and families are coming to us with. So the scientific and technological progress has and it will continue to reduce our ability as physicians to solve our patients' and families' problems single-handedly. It requires that team effort beyond even those that are medically trained, as I was just saying. So this free data or the patients' and families' own opinions about it, but most certainly also taking into consideration the growing team care model of healthcare. And this in itself can actually present additional challenges where it can make the healthcare sometimes more disjointed and harder to have more coordination. It can disrupt that one-on-one relationship because it is being farmed out or being spread across so many areas. And I know a lot of this is being driven by the economic incentives and the reimbursement, but that's the reality that we all have to face and have to address and accept and make the most of. That's why understanding our role and understanding what all these factors, this evolution means to how we show up effectively and still continue to be those medical experts and leaders and be able to lead those team-based care models. Add to that the fact that there is also evolving and expanding roles of other healthcare professionals, like the mid-level practitioners, for example, and not only just expanding and evolving roles, but also just the blending of those boundaries of how many mid-level practitioners can now practice independently and where and to what extent. So being aware and understanding the exact roles that each of these other healthcare professionals are playing along with you is very important in order to remain most effective and efficient in your own role. And while these changes in the healthcare system will continue to emerge, they will not remain same maybe 5 years down the road. It is, however, important to understand and embrace the full spectrum of your own role and ideally to evolve as things are evolving. And even more ideally, if you can stay ahead of the curve, not trying to evolve, trying to change once the change has already occurred, because then the cat's out of the bag and we are hardly able to have the decision-making capability. However, as I said, if you understand and embrace the full spectrum of your role, you are able to step in and assert as well as influence these changes. And when I speak about the full spectrum of role, I'm referring that not just in relation to your patients, but also in relations to your colleagues, the divisions, the department, the institutions, and even the community and society at large. So that's why I want to highlight all these different roles, whether you actually hold the title of any of these or not, but these are the roles that you all are going to be playing. We all are going to be playing and continue to play. We just need to make sure that we understand what these roles look like with evolution of the healthcare landscape and the society around us. And that understanding allows us to evolve into the best version of ourselves as professionals. As our profession evolves, we can stay true to the roles and we can maintain the status, the responsibility, and the stature that has been traditionally afforded to physician and as a professional. Now, some of you may say, that is very overwhelming and that is too much. Why do I need to prove to anybody that I am the expert? Well, as we know, today's society has changed expectations, right? We fail to evolve with the evolution of the society around us. What it does is basically results in the erosion of our doctor-patient relationship and even the faith in our profession. And we're starting to see some of that. So not only does it erode that relationship, it actually leaves us very dissatisfied. It leaves us in a shortcut to burnout and frustration with our own. It leads to the diminution of our professional stature and the perspective that a physician actually has major contributions to make to our patients and to the society and to the healthcare and to even our own healthcare administrators. And as I said, most importantly, to our own selves and self-satisfaction. And the other aspect, as I just briefly mentioned, was it influences our own ability for maintaining our own autonomy. If we don't stay ahead or at least along with the curve, this changes, then we lose the ability to influence what happens in our own practices and in our own professional lives. And we all know what that means. That's going to lead to frustration, loss of interest, poor job satisfaction, and as I said, burnout amongst these physicians. In order to steer our healthcare ship to a more pleasant destination away from the burnout, you all need to evolve in your roles while maintaining the most important elements that humans as social beings value despite their love for the advances in technology. And what are those? Well, those are the other roles that we are still expected to play. So our other roles in the healthcare today, besides being the medical expert, it includes being a great communicator, being able to maintain that expert human connection. So maintaining that human contact, but still with the expertise. In other words, we need to be able to give them our expert opinions, yet we need to make sure that we're doing all that, meanwhile making our patients feel better and retaining their confidence in us as physicians and making them feel valued and included in their decision, making sure that we understand their goals and that those are aligned with the treatment plans that we are providing them. We need to foster the patient autonomy, which means that we need to respect the rights of our patients to make choices according to their values and their understanding of how those values impact care decisions. Not only do we have to give them the expert knowledge, but we need to make sure that it is relevant to them, that they understand it and they value it, and that they see this as their own goals and important to them. We also need to, like I said earlier, acknowledge any of their own personal beliefs and all the information that they may come with. Granted, if that's irrelevant, which sometimes it is, we need to be able to acknowledge and yet expertly steer them towards more pertinent and relevant information. But remember, you can only do that if they trust you, and they will trust you if you allow them some autonomy, some engagement, and some trust. Again, comes from more of that personal human connection, that autonomy, that acknowledgement and endorsement. We need to ensure that they feel like we're partnering with them. When a physician views their patients as their most important teachers, the mutual sense of gratitude and respect will cement the quality of the relationship, and it enhances the clinical experiences of both the parties. Of course, we have the educational process to train us as physicians, but we never cease to learn. And that is one of the qualities that one must continue to possess and value throughout our careers. And that is being an educator and a learner, which is our next quality, as in being coach and educator. Like I said, not only do we learn from our patients, we also learn from the medical texts and our training, as well as we're constantly educating. We're educating our patients and families. We're educating our other trainees and our other healthcare professionals. And we need to keep this two-way learning process and education process going and propagating. We need to proactively promote population health as educators. We need to educate our patients and families, even when we differ in our opinions about their perceived diagnosis or treatment plan versus ours. We need to be able to reconcile that with positivity and proactivity, with positivity and engagement. Moreover, as I said, we train the trainees as well as our other healthcare colleagues and stakeholders, especially as pediatric pain professionals. We're consultants. We're consulting with other healthcare disciplines, and we need to not only just provide the consultation services, we often need to educate them why a particular treatment plan may be necessary, why we can't yet change our patients' treatment routes to oral as opposed to the PCA or the regional anesthetic that we may be providing, why a certain medication needs to be given as opposed to the others, because they have seen some other medication being used for similar patients. So these are some of the things that we need to keep in mind and continue to educate on ongoing basis. More importantly, we need to be able to educate our other colleagues and other stakeholders where we cannot always be present in order to make sure that our patients are getting the quality care that they need to be getting. And more on this as we speak about our roles throughout the institution or in our community as a whole. You see, our role as educators and coaches extends beyond just to our patients and families. But sticking with the roles that we're still expected to play with our patients and families, another role is the role of a counselor, which to some extent I got into a little bit as we were talking about education and teaching. In some ways, that also includes counseling our patients. So we're giving them the relevant, most pertinent, evidence-based, and most helpful information that we as experts feel would be for them, hopefully balanced with our patients' goals and their challenges being taken into consideration. And that's what a role of a counselor is, providing the information. However, the additional role that we're playing as counselors, or we're supposed or should be playing as counselors for our patients, is ensuring that they are taking the initiative and they are engaged and proactive in their own care. So we're providing them the information and the tools that they need or the directions. However, what's really important as a counselor, as a coach, is to get them to engage and move the needle forward for their own care. Now, we're also doing this counselor role in other contexts beyond our patients as well. Again, as I said, we will speak about this in just a moment as we talk about our role as a pediatric pain physician in the context of non-direct patient care. Lastly, as a support. So without belaboring the point of support, I would just say, referring back to the fact that we're allowing our patients autonomy, we're partnering with them, we're coaching them, we're educating them, we're acting as their counselor, all these, in other words, form as a support for them. So we are basically helping our patients remain functional and participating in their own day-to-day activities as best as possible despite their pain, and while they are trialing their therapies, which may or may not be effective right away. So instead of them waiting for their pain to go away, we want them to return to function as best as possible, as soon as possible. And this is where how we support them would play a tremendous role. And in our Physicians Academy, we delve into all these roles in much deeper, and how exactly can we achieve these functions, and how you as a physician can achieve these functions is what we engage and educate you and train you about. And another important role you're playing with your patient or during your patient care is role of a leader. So even though we are focusing so much more on partnering and engaging and empowering our patients, we are also simultaneously acting as leaders. In performing all these roles, we are acting as leaders. In providing them with the medical expertise, leading them to the expert, evidence-based, effective medical care, we are stepping up as leaders in reconciling the differences between their opinions as well as what we as medical experts feel is the appropriate course of action for them we are acting as leaders as well. The various roles that we're playing for our patients' care are, number one, the medical expert, including creating that human expert connection with them. Number two, providing them the master clinical expertise. Number three, fostering patient autonomy. Number four, acting as partners. Number five, acting as their educators, coaches. Number six, acting as a counselor. Number seven, as a support. And number eight, and to top it all and to tie it together, as a leader. Now let's move on to your role as a pediatric pain physician as it comes in relation to your institution or your practice. In your institution and in your practice, you still need to have all these other roles. You still need to be the expert and the educator and the collaborator. However, in addition, your management and team skills in delegating and understanding the responsibility within the multi-professional care teams, especially as a pediatric pain physician, are going to be paramount. As a leader, you set the tone for what and how much priority is going to be placed on pediatric pain. What is the greater culture around your pediatric pain care? And what is it within your division? What is it within the department? And at the institutional level, and even locally and regionally, you may be able to determine as well as influence that standing, that priority, and that culture. And paramount to that is going to be your own expertise. If you are viewed as an expert, your level of leadership, whether you have a title or not, will be automatic. As an expert, you will dictate the standards of pain care across the institution, and you will set and ensure the quality and safety measures throughout the hospital. You don't have to be providing direct care everywhere, but you can dictate and direct the efforts being implemented in other areas. So, for example, if you're a pediatrician or an anesthesiologist, you still might be able to influence how pain care safety standards or practices are in the emergency room, for example. Not only that, through these influences, you might be affecting the operations and the throughput of the hospital itself, because the quality of the pain care will determine the length of stay, patient satisfaction, and how fast your patients are moving from admission to discharge. It also will influence the reimbursement that is being tied to the patient outcomes as well as patient and family satisfaction scores at this point. And ultimately, what you're influencing is the cost of healthcare within your institution as well as at the societal level. You are influencing the bottom line of your institution and of our community. You're also influencing the performance measurements and value-based payment, as well as even how regarded or valued your institution or your department might be. In some cases, even the accreditation and honors that are afforded to your department, your division, and or your institution, for example, the U.S. News and World Report may be creating ranking based on the quality and stature of your institution. Because by current standards and regulations, institutions are required to have policies for pain assessment and treatment and to ensure that all staff are educated and compliant with these policies. Now, regulations also require that institutions have to maintain a certain level of performance, which is often determined by the patient and family satisfaction scores, and even their accreditation may be dependent on that. To give you an example, one of the major institutions that I was the director for pain and palliative care, we were instrumental in incorporating our pain and palliative care services in order for our oncology and ICU programs to be considered as one of the top in the country for their own accreditation. through the US News top hospital ranking. So you see, even though you may not have the title of a leader, even though it may not be a formal thing, you are still influencing the entire culture of your institution. And as I said, even the bottom line of your hospital. So you are playing all these roles without them being explicit. But if you happen to be a division leader or director, all the more reason that you should be more mindful of all these roles and should play up your strengths to the best possible level. As I said, you also have a role that you play in the community, whether it's locally or nationally or even internationally. But this may, again, not be obvious in your titles, but you're still playing a role. For example, if we look at the pain program at Boston Children's pretty much is considered as the standard for what healthcare practices for pediatric pain should look like. And to you, I would say that not all patients can make it to Boston Children's Hospital, so we should be able to duplicate some of these practices even in your own institutions. That should be your goal, because in your community, you might be the Boston Children's Hospital. So the children in your community deserve the kind of care children in Massachusetts or in the areas close to Boston are receiving. You can play a role in the advocacy of how patients receive care. You can play a role in the standards of care and regulations or policies that are being set within your institution. And you don't need to go very far. All you need to do is understand and develop your own expertise. You can also tap into some of the resources like the International Association for Study of Pain or the Childkind International to get help. You can turn to the Society for Pediatric Pain Medicine as a resource. Other roles that you need to play are education and awareness, whether it is of the public or other healthcare professionals, as we discussed earlier, that we may need to educate our colleagues, sometimes our other stakeholders, our other consultants, our other divisions and disciplines. We may even be able to influence how those divisions and disciplines carry out their own educational curricula for their professionals, their residents, and their trainees, incorporating some basic pediatric pain management training in their own curricula might be helpful. Then you truly show up as experts, whereas they can do some of the basic pain management for their own patients. Many institutions will have ability to provide PCA as a analgesia modality, and being able to create some standard training around that or influencing the curricula around those trainings is a role that you can easily play. And you also play a role in the discovery and dissemination of the information around pediatric pain, whether this is through research, which can be bench research, but even clinically in what you do day to day, keeping a database, tracking the outcomes, tracking the influences that your interventions are having in itself is going to make a difference. Even simple things as reporting cases that may have had unusual, unexpected outcomes may be important to share that broadly. Other role you play as a larger community are setting standards of care, whether it's through networking, sharing your experiences, protocol discoveries. You may have unique patient population that you typically see. For example, some of the institutions like Cincinnati Children's or Stanford will see patients with epidermolysis bullosa that others don't. You may be seeing patients with Ehlers-Danlos syndrome, or you may be seeing a large number of sickle cell patients and oncology patients, such as St. Jude's does, that other places may not be seeing. So you may be able to share your expertise and your experiences with other institutions by collaborations, by creating networking, sharing databases and protocols. Ultimately, you are influencing the cost of healthcare based on your resources, your population that you're serving. you may have a unique opportunity to influence how the healthcare costs can be curbed. And ultimately, your contributions will determine the credibility and the stature, not just for your own self as a professional or for your division or your department or institution, but it may be for the entire discipline of pediatric pain medicine. Your voice, your clinical educational research and advocacy efforts, they add to the efforts of many of your colleagues across the globe, and they provide legitimacy and credibility to the specialty of pediatric pain medicine. So you need to embrace that role and continue to contribute to all these aspects in whatever degree, whatever level. Now, whether you admit it or not, you're not just doing a job. You're an integral part of creating and shaping the culture of pediatric pain care. And to be honest, healthcare in general, because children are future of tomorrow. And the healthcare costs related to pain are massive. Therefore, I would highly encourage you to approach it with that mindset and with that attitude. That attitude and mindset, my friend, is the attitude and mindset of a leader. That's exactly what your role as a pediatric pain physician is. Whether you recognize it or not, whether you want to call it that or not, or whether you have that title or not, that is exactly what you are. So you might as well embrace and love it and enjoy. And I'll end with a quote from Martin Luther King Jr. about leadership. He said, "A genuine leader is not a searcher of consensus, but a molder of consensus." So you, my friend, are molder of this consensus of how and what stature pediatric pain medicine should enjoy. So embrace it and enhance it. Now, as always, I like to hear from you. Do you agree with my assessment of your roles as a pediatric pain physician, especially as the leader? If so, let me know in the comments. If you don't agree, that's okay. I'd love to hear about your opinion. What do you see as your role? What do you see as a challenge to whatever role you may see or embrace, most importantly? Let me know in the comments. And again, I would love for you to subscribe if you haven't already to our Pedia Pain Focus so that you continue to get all the new episodes as soon as they're available. I'd love to hear from you. I'd love you to hear about all the great episodes that we continue to put out week after week. Also, if you can take a moment to please review the podcast, that helps us tremendously and helps your other colleagues in getting this information to them that they may or may not be aware of otherwise. So your reviews gets this podcast in front of other people and makes it more accessible. So thank you. Thank you for joining me this week. I will talk to you in 1 week's time. Until then, stay proactive, stay safe. Bye now. Pedia Pain Focus is a presentation of Proactive Pain Solutions, a company committed to transforming pediatric pain care through improved access, quality, and expertise. There is a large gap in children's pain management. Did you know 1 in 3 school-age children are suffering from chronic pain? That's 19 million children in the U.S. alone. Meanwhile, there are only a handful of programs that provide pediatric pain medicine training. This leaves children's pain in the care of hands of untrained healthcare professionals and results in frustration for both the groups, patients and their healthcare professionals. Data clearly shows that untreated or poorly treated children's pain leads to much higher incidence of chronic pain into adulthood and mental health diagnosis and a huge societal burden. Proactive Pain Solutions Academy is the answer to this major problem. It fills this large gap through our comprehensive, evidence-based virtual training which is bolstered by live Q&A sessions, personalized mentorship, and leadership training development. Now, our enrollment only opens for a limited time and only for a limited number of spots. So join our early bird waitlist today and be the first one to know as soon as our doors open. You don't want to miss out on this opportunity to have the expertise at your fingertips, the expertise that will help you improve your patient outcomes and satisfaction as you watch your own confidence and professional satisfaction soar. So join us today.